today, a patient with nevus, with it's pushing up on the macula here, localized detachment. This is a malignant melanoma. This is one of my patients. Sudden loss of vision, down to 660 the day before. There is the optic nerve, and the whole of the eye is covered with blood. This is a central retinal vein occlusion, and it also causes fluid in the macula, so his vision was poor. He had invasive injections for this. A year later, this very nice man using the same road as me, he died of stroke. So this is the precursor of a brain hemorrhage later on. 30-year-old woman presented complaining of visual disturbance. This actually was the makeup. She could see a line in her vision. My colleague Menachem Selasnik, who actually lives in Israel, he comes back 5 times a year to work in the practice in London. He lives in Yerushalayim. He saw her, he found what the problem was on the retina, and we did an OCT. That's the problem on the retina. Here, there's a little infarct. It's a little cotton wool spot, a little area of edema. No hemorrhage. Healthy woman. So we put her on the OCT. There's the optic nerve. There's the macula. There's the little area of swollen retina. If we go back, just to show you, there's one blood vessel. There's the other blood vessel. The cotton wool spot is in between. There's one blood vessel. And there's the other one. And there it is. So, I checked her blood pressure. That was normal. Her husband's a GP. I checked her blood pressure. Okay. She's going to Israel for a holiday. She said, what shall I do? I said, don't worry. Go on your holiday. Let's look at this in 2 weeks when you come back. This, by the way, was the OCT as well, showing that the thickening was definitely in the sensory retina and not coming from the choroid. It's here. This is swelling. So 2 weeks later, almost gone. Yes? Nothing there. Gone. Now, if I had sent her to an ophthalmologist, by the time she had got there, 2 or 3 weeks later, there's nothing there. I saw her again very recently, 2 months ago, for a year follow-up. She had all her bloods checked. Nothing wrong, all blood tests were normal, and there's nothing. This is not a reoccurrence. This was just a little episode for no reason that we know. So, just to conclude here, the OCT is really a fantastic technology. Not so new now, it's been around for 5 or 6 years in practices. In the UK now there are about 300 optometry practices who have an OCT. And it's very useful to diagnose and manage and expand our scope of practice. So again, I thank you for listening.